Good afternoon. This is MTP number 62. And today what I'd like to do is have some rapid responses to a bunch of questions from previous MTPs, because these are great questions that I always refer back to when I lecture urologists, and I don't get the questions that the patients get, and I get to take them back to my colleagues because you guys have the best questions of all. So we're just going to bang right through, I think, 6 or so questions regarding previous MTPs. First one's from Paul SDRC. Paul asks, and I'm going to just correct his anatomical description a little bit, but he says, have you ever seen the spongiosum grow back after an implant? To the point that it obtains about 80% of an erection before inflating. So, people have asked, the question, if I took the implant out, would I be able to get back to the way I used to be? Yes, you will. You will be impotent like you were prior to the operation. Now, our goal is to spare as much of this spongy tissue, okay? You said spongiosum. It's actually corpus cavernosum, that's the erectile tissue. But we try to spare as much of that tissue as possible. And the real joy that we get is when we hear that first or second week from our patients, I feel like I'm getting my own erection. Because we really have advocated for less dilation and less beating up, let's say, of this erectile body tissue, so that you feel like you're getting your own erection. So I wouldn't give it a number, and I would definitely say that if you get an implant and you had to take it out, you're going to go back to the way you used to be. But in the hands of a dedicated urologist, a dedicated implanter, they're going to spare as much of that tissue as possible so you get that feeling, that kind of rush that you got before. Let's go. Medi Z. I can't say his last name. Medi Z had 2 questions. He asked a question. We were talking about the use of a vacuum device and a ring in a patient who has a penile implant in order to get glandular tumescence. And he asked, where do you put that ring? You want to put it around the base of your penis, because the urethra and the glands, the head, are all contiguous. So you want all of that to swell. So you're not going to put it up around the glands. You put it all the way at the base, Medi Z. And then Medi Z asked me, I did my research, and I found that only the AMS LGX supports lengthened girth growth, and the Titan doesn't. This is something that the 2 companies, the only duopoly in surgical devices, they go back and forth about which one makes the penis grow more. Both of them, in reality, will make the penis grow, because both of them will mount supraphysiologic pressures, thus allowing the tissues to expand. So whatever marketing you're getting from the companies, take that with a grain of salt. In reality, they both grow. Now, the Titan is made of an elastomer, and that's why I use that more often, because an elastomer has a tendency to grow in both length and girth symmetrically. Let's see, my phone is ringing. I'm going to ignore that. Richard N. I'm not going to use your last name. So I'm a grower, not a shower. During my younger years, I was 8 inches or so. By the way, 1 out of 30 men are 7 inches or more. 1 out of 50 are 8 inches or more. And if you're 1 out of 50, God bless you. He goes, can I get that back? Go back to penis size. I'm getting so many repetitive questions about length and girth in patients who have had erectile dysfunction. Understand, if you have erectile dysfunction, you are suffering some element of atrophy of your penis. And it's only going to get smaller. It never gets bigger. And the process of atrophy doesn't stop until you get the penile implant into place. Once it's in place, watch MTP 57, and that's the way to get your penis to grow. Mr. No-Show, okay. For someone in their mid-30s, is a great question. Is there a limit to how many times you can have the implant replaced? And I did refer to a paper that was written out of Mayo Clinic looking at revisions, surgery, and infection rates, and it's terrifying. If you're a young man and you are impotent and you're contemplating an implant and you realize that there is life expectancy, and you should look into the life expectancy of the implant that your implanter is offering, It's terrifying when you read that paper, because it was very high percentage increases in infection rates in revision surgery. And I think if you're looking at revision surgery coming out of a dedicated center, you're going to see much lower infection rates in these patients because of something called biofilm, and I'm not going to go into too much detail on it, but current research is showing that you get yourself a dedicated implant, or you have a streamlined approach to putting the implant in. If and when that does break, your infection rate should be similar to the original one, and thus there is no limit, to answer your question, for having these things revised. Both implant companies have made significant advances in their technology in order to make these implants stay viable inside of your body. Ron Smith, in regards to the UroFill enlargement, can you do it with the penile implant? Yes, but only in a certified center where they understand the patented technique. You're going to have a bunch of people saying they know how to do this. Unless it's a UroFill certified provider, I would not go anywhere near them, especially in the case of a penile implant, because the bucket mouse asked the same question, and he was worried about rupturing the cylinder or puncturing it. Absolutely. This is the reason that UroFill is staying in the hands of board-certified urologists and not going anywhere else. So, awesome questions, and I kind of like this rapid-fire thing. We'll try to do that maybe a little bit more often. So we'll see you on the next.